tonight.
Try not to get upset, but we found 3 small spots on your brain. There's a procedure called Gamma Knife.
What that entails is focused, targeted radiation that's aimed just at the abnormal areas we see on the MRI.
He said, we're going to do your procedure the next day. So I really didn't have time to worry or think.
Brainstorm, sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. When you hear the word Gamma Knife radiosurgery, it sounds like a complicated procedure, but it's not. It's high-tech equipment used to treat brain tumors and much more. The latest statistics show more than 700,000 Americans are living with brain tumors today. 80,000 people will be diagnosed with brain tumors this year. Brain cancer is the 3rd most common cancer for young adults ages 15 to 39. What is Gamma Knife radiosurgery? How can it be used to treat brain tumors? What other neurological conditions can be treated by Gamma Knife? You will find out tonight. And if you have questions at home, Sonny Diamond is here to tell you how to get them answered. Hi, Sonny.
Thanks, Deborah. Specialists from Penn State Health are in the ABC call center right now. And we are in the call center to answer your questions until 8 o'clock. Call the number on the bottom of the screen, or you can email your questions during the show to questions@abc27.com. Dr. Leonard Twankin will answer your emails throughout tonight's show. All calls and emails are confidential. I'll be back later in the show to share some of those questions with you. Deborah, back to you.
Thanks, Sonny. A Dauphin County woman exercised, ate the right foods, and rarely saw her doctor. But on her last visit to the doctor's office, Andrea Foreman received some news that left her in shock. Here's Andrea's journey. Andrea Foreman can't talk enough about her trip to Europe with her daughter, Haley. It was a graduation present.
I said, pick a big trip. Let's go somewhere. And she's always wanted to see London. So I said, well, then, let's do London. And while we're going there, we should probably try to see Paris for a few days.
A date was set. They would fly to England in June.
We started planning in January, and we were watching YouTube videos on different things to learn. I bought all of our subway, like tube cards, they call them. I pre-purchased those. We mapped out all of the subways, the tours we wanted to do, the tickets for the show.
A perfect plan that almost didn't happen.
It was soon after Easter. I had a cough for just a couple weeks, and it didn't seem to go away, and I went to the doctor.
Doctors initially treated Andrea with allergy medication.
They thought it was allergies, and the cough went away, but I said I was having trouble getting full breath. And I said when I was laying down, I heard like a crinkly sound, and he said, oh, you might have fluid. So they sent me for a CT scan, and that's when they found a tumor on my lung.
Here we have the tumor in her right upper lobe. And at the bottom of her right lung, you can see the fluid that was causing her a lot of the shortness of breath that she had when she first came in.
They found it was lung cancer, which shocked me because I don't smoke. I've never even been around smoke. And I just had no idea why I would have gotten that.
Doctors diagnosed Andrea with stage 4 lung cancer.
I was completely a wreck. In fact, I couldn't even drive home that night. It was terrible.
Andrea's next thought was her daughter.
I had told my doctors I had this big trip planned for my daughter. It was a gift. So they reassured me that I will make it on that trip, but we're going to have to hustle with all the testing and everything I had to have done before I left.
So she had an initial PET scan, which is kind of looking at everything. Looking at the big picture. It doesn't really give you a lot of specifics, but kind of gives you an overall picture. And there was some concern that there may have been something in the brain. And that prompted additional imaging of the brain, which then revealed 3 small areas of the brain that were concerning for what we call metastatic tumors, or tumors that have spread from somewhere else and gone to the brain.
The day before I was leaving, I took a vacation day just to finalize everything. And it was around noon, when she called me and said, are you all ready for your trip? I said, yeah, we're all ready. And she said, well, I just want to let you know, try not to get upset, but we found 3 small spots on your brain. And I turned white. I just was like, what? I'm leaving tomorrow.
So her symptoms were actually quite well managed, and I felt comfortable letting her go on vacation, which I knew was very important to her and her daughter. And we could hold the treatment until she returned 2 weeks later.
She said, I really feel confident that we're going to get it, and there's a procedure called Gamma Knife. So she said, you have a great time, you and your daughter, and we want to hear about your trip, and we'll see you when you come back.
And when they returned home from their trip, Andrea knew there was a plan.
So I came back on a Friday night, and that Monday I met with Dr. Zakaria, and then he was very calming, very reassuring to me. And he said, we're going to do your procedure the next day, Tuesday. So I really didn't have time to worry or think.
More and more we've gone towards doing a really focused, targeted radiation treatment for this. We call radiosurgery, and specifically we call gamma knife radiosurgery. And what that entails is focused, targeted radiation that's aimed just at the abnormal areas we see on the MRI. These are invisible beams of power, and it's 192 individual sources of radiation that each individually really don't cause any damage, but when they converge and meet in a single point, can cause injury to that specific area.
He said it's a procedure he's done so many times. He's very confident that he can get the spots.
Andrea went back to work a day after the radio surgery.
I just can't even believe things like this exist. I would have thought it would have been invasive, and it wasn't.
A high-tech procedure that's making a difference for Andrea.
Her 1 month follow-up scan looked excellent, with a slight decrease in the size of all the tumors that we treated, with no other new tumors.
He said, you know, I have great news. There's no more spots. We did get it that time, and you're good to go. He said, I'll see you in another 3 months. So it was a good day.
Andrea has had more good days. The tumor in her lung is shrinking. After the gamma knife procedure, she had radiation, and she is currently on immunotherapy. Now joining us is Dr. Brad Zakaria, Director of the Brain Tumor and Skull-Based Program. Thank you for being with us. Gamma knife treatment really is amazing. Who is a good patient versus someone who needs more invasive surgery?
Yeah, I mean, more and more we've moved to try to make things as less invasive as possible. There's still some patients with really large tumors, patients who have really significant neurologic symptoms who still require traditional surgical approaches. But patients with smaller tumors, those with multiple tumors in difficult to treat areas, those are really ideal candidates for gamma knife.
And this does seem more like a minimally invasive procedure. What are the benefits?
Yeah, I mean, that is the benefit. I think you saw with Andrea's piece, this is something where patients are back to work the next day. There's almost no downtime. They don't have to stop medications that they're on or interrupt what other treatments they might need. And that's a big shift from where we used to be. And that's really the advantage of the procedure, and it's incredibly effective.
And how does it work? So you come in the morning?
Yeah, so you come in early in the morning. The team plans your radiation based off the pictures that we obtain. You get the radiation, it's painless, doesn't hurt, and then we get you on your way. Most people experience really minimal to no side effects that day, and are usually back at it the following day or within several days.
And what about follow-ups?
Yeah, so we typically see people frequently. We see them in typically 1 month after the procedure, really as a check-in to make sure they're doing well and that the treatment's done what we want it to do. And then we'll typically see them every 3 to 4 months. Follow them up, make sure that nothing's changing, because this is a procedure that, if need be, can be repeated.
And what other neurological disorders does it treat?
Yeah, this could treat a variety of neurologic disorders, not just tumors. We also treat vascular malformations that can be quite difficult to treat, and also disorders that involve pain, so compression of nerves that can be treated very effectively, non-invasively with gamma knife.
Okay, Dr. Zakaria, we will talk to you a little bit later in the show. And if you would like to make an appointment with Penn State Health, this is the number to call, 855-945-1282. Now let's check in with Sonny Diamond in the ABC 27 call center. How's it going in there, Sonny?
Wow, Deborah, the phones are busy, so we're really happy about that. And you can call 717-346 3333. And here to answer our viewer questions tonight, Dr. Lila Chelaby. Welcome. She's going to be with us. She's a radiation oncologist who has our first viewer question. Dr. Chelaby, the question is, I was recently diagnosed with a brain tumor and was told radiosurgery could be an option. Would I still need chemo and radiation after the procedure?
That's a great question. So each treatment is individualized to the patient case. So I would recommend speaking to your doctor to find out what the best treatment course is in your particular case.
Very good. Thank you, Dr. Chelaby. If you have a question or you need a specialist that you would like to call, you can email your question to questions@abc27.com. Stay with us. We'll be right back.
You're watching Brainstorm on ABC 27, sponsored by Penn State Health.
Welcome back. A Franklin County woman experienced extreme facial pain for several years. Nothing helped until she met a neurosurgeon at Penn State Health. Here's Mary Kay Rogers' journey. Mary Kay Rogers has made thousands of cakes.
So I do almost any kind of cake, wedding cakes, Marine Corps ball cakes, kids cakes, I do cupcakes, I do decorated cookies.
She's been doing it for the past 25 years. In fact, she has her own shop.
Love to see the reaction on kids' face, adults' faces when they get the cakes.
Something that brings Mary Kay so much joy. But a few years ago, she had to turn the blender off after she started having some facial pain.
Like half of my tongue felt like it was completely burnt, like if you burn yourself with a cup of coffee with your tongue, but it just stayed there all the time. And then the left half of my face up to my eye felt like someone was like punching you.
Mary Kay thought there was something wrong with her teeth.
So I kept going back to the dentist and she was like, no, nothing's wrong, everything looks good. She sent me to another dentist. He said the same thing. There's nothing wrong with your teeth, gums, nothing.
Mary Kay's next step was to see a neurologist.
He did some different tests and everything on me, and that's when he diagnosed me with the trigeminal neuralgia.
Trigeminal neuralgia is a severe electrical shock type pain that's always on one side of the face that happens to people typically as they get older, which they will describe as the worst pain they've ever experienced.
Doctors gave Mary Kay different medications, but nothing seemed to work.
There were days I couldn't even ice a cake or anything. It was just so terrible. I would just lay on the couch and you're just in pain all the time.
There was an event in the Marine Corps that when I was there in January of 2016 called St. Barbara's. She did the cake for it, fought through it to do the cake, and then pretty much after the initial ceremony was done, she's like, I gotta go to the room.
I had a couple procedures done that didn't work for me personally. The neurologist sent me to Hershey Medical Center, and they're a godsend because Dr. McInerney, he knows I love him.
She loves Dr. McInerney because he had a possible cure.
The thing that we do most commonly for this problem is radiosurgery with the gamma knife. And the biggest reason for that is because it's by far the easiest of all the procedures that we can offer for this for people to get through.
And would I be interested in trying that? Of course I was interested. I wanted the pain gone.
The patients come in the morning and we put a frame on their head, that's the dramatic part, and then we get an MRI scan. And the frame is our measuring device.
I was like, oh my gosh. But whatever medication they put you on when you go in there, it's amazing. You don't even know they do it.
The trick with the gamma knife is we take 192 beams, so low dose, low power radiation beams, and point them all at the same spot. So that while everything sees radiation, the only thing that sees enough radiation to be damaged is what we actually put at that center point. And that's what allows us to be very, very accurate.
And the staff, they tell you it's not going to work right away if it works. you know, each week or each month it's going to get better. By the time July came, I have had no pain. When I went back for my 3-month, I have not had any pain.
She's back to being more of what normal like she was before. You know, she's able to do the things that she enjoys to do.
It's amazing. I mean, I can get up in the morning, I know this sounds trivial, but clean my house, I can cook a meal.
She likes going out with our dog, Gunner, and playing with him when it's nice outside.
To have something that actually works, I'm amazed. Now I'm really enjoying life because it's gone.
Mary Kay said if this procedure only worked for one day, it was worth it. The pain she had was paralyzing. Now she is doing great. Joining us right now is Dr. Jim McInerney. Mary Kay did talk about the pain. Tell me about how bad is the pain with trigeminal neuralgia?
Sure. Well, patients with trigeminal neuralgia will tell you it's the worst pain of their life. And people who have had terrible pains like childbirth or heart attacks or kidney stones will tell you it's worse than that. And so it really is terrible, debilitating pain that really can stop people in their tracks.
And as we saw with Mary Kay, it was very difficult for several years to really diagnose that she had trigeminal neuralgia. So if someone is watching this, has similar symptoms, what would you suggest?
Sure, and unfortunately it's a really common problem because it's not a common problem that people have. And so a lot of times people will go through getting misdiagnosed or not accurately diagnosed. But when people have that, you know, that pain that respects just one side of their face and it's very severe and sharp and stabbing, when there are things that are triggering it, like chewing or brushing their teeth or something like that, then they should really get in touch with their doctor and tell them about those symptoms and hopefully seek out neurologists, neurosurgeons who can give them the types of treatments that will take care of the problem.
And really, what are the long-term benefits for treating trigeminal neuralgia with Gamma Knife, and how soon will a patient see some relief?
Sure. So patients will usually start to see relief within 7 to 10 days, so a week or so, and they're starting to feel better. And that continues to improve over the course of about 3 to 6 months. And then once they get completely better, they usually maintain that for years, 5, 10 years or more. It can come back, unfortunately, but the good news is we can treat it again if it does.
Yeah, that was my next question.
Yeah.
Is it something you can do again?
Absolutely, yes.
Okay, great. And we know that at Penn State Health, your goal is really to give patients the life they were living, give that back to them. And we know that Mary Kay loves to bake, and she is able to do that again. In fact, she is here. She has something for Dr. McInerney to thank him.
Thank you for you.
Oh, that is awesome.
Thank you.
Wow, how appropriate.
Yes, thank you for giving my life back. I mean, it's amazing. I recommend it for anybody.
Well,
you know,
so
if they have the pain to go. Thank you so much.
Oh, that's awesome.
So artistic. I know that you are an artist and you do a wonderful job with designing cakes, and this tops the cake.
Absolutely.
Mary Kay, thank you.
Thank you.
Thank you for doing the cake. That's wonderful. And Dr. McInerney, thank you for being here.
My pleasure. Thank you.
And if you would like to make an appointment with Penn State Health, this is the number to call, 855-945-1282. Once again, 855-945-1282. And let's go back to the ABC 27 call center. How's it going in there, Sonny?
Thanks, Deborah. Well, we only have a few more minutes to get our questions in, so do call 717-346-3333. The phone lines are open until 8 p.m. If the phone lines are busy, you can email, and your questions will go to questions@abc27.com. And here's our next viewer question for Dr. Lila Chalabi. I am scheduled to have a Gamma Knife treatment. Will I be able to resume regular activity after the treatment?
Absolutely. There is little to no downtime following Gamma Knife radiosurgery. Most of our patients leave shortly after the procedure and are able to go back to to have lunch, go back, be with family and friends. It's very well tolerated.
Thank you, doctor. And we do have one more question. I was wondering, and this third question and our last one for the evening, my doctor recommended gamma knife treatment for me. How much safer is it compared to the whole brain radiation, and is it more effective, doctor?
Gamma knife radiosurgery is a very effective treatment, and there are fewer side effects than with whole brain radiation. So if it was recommended for you, I would certainly recommend proceeding with the treatment.
Absolutely. Thank you very much. Thanks also to our specialists tonight. We really appreciate their help, and they've been here all night answering your calls, and we're going to let Deborah have the show. Thank you, and thanks to our specialists.
Thank you, Sonny. A Lancaster County woman is all too familiar with the word cancer. She's been diagnosed with cancer more times than most of us will in a lifetime. Here's Kelly Lynch's journey.
38-year-old Kelly Lynch could write a book. It would go into great detail about surviving 5 separate cancers. The latest chapter would be about her latest battle, a brain tumor.
This past summer, we were on a trip to Costa Rica. The night that we got home, I went to bed, and my husband came to bed and apparently said that I was breathing very strangely.
It almost sounded like she was having a really intense dream, but it kept going on for probably a good half a minute or so. And I started to get concerned that something wasn't right here. So I kind of went to try to shake her to wake her up, and she didn't respond in any way. And then I realized that something more serious was happening. Called the paramedics, and they said, "We think you had a seizure. We'd like to take you to the hospital and get you checked out."
I went to the hospital, had a brain scan, and found a tumor in my brain. While I was at the hospital, I went into another seizure and was transferred to Hershey Medical Center.
This tumor was about 3 centimeters. That's more or less like 1.5 inches. Located in the left temporal region. This is in an area that is also involved in speech and language function, oftentimes involved in what we call receptive language, kind of really understanding and comprehending complex speech.
So this was my 5th totally different type of cancer.
5 different cancers. A gene mutation is to blame.
Leave from many is a mutation that makes your cells just more prone to develop tumors. There's no guarantee that they will, but you're just more prone to tumors in general. Could be malignant or benign.
Kelly chose to have the brain tumor removed surgically.
We proceeded with doing an awake surgery, again with the goal of identifying critical areas that are involved in the comprehension of speech, understanding speech, protecting those areas, and removing the mass in its entirety, both to get a diagnosis, to alleviate the symptoms, prevent further seizures, and get control of the tumor.
I don't remember much of anything, but what they would do was wake me up and ask me certain specific questions just to make sure that my brain was functioning, and everything turned out beautifully. He was able to get everything that he could see. The surgery was a major success.
I saw her after the surgery to determine if there would be a benefit in adding radiation treatment to the surgery she had on the brain. And the reason that radiation is offered is to reduce the risk of the cancer returning in the brain in the region where the surgery was originally done.
And it was actually completely seamless. What they did was they numbed my skull in the areas where they needed to attach like what I would call a halo. I'm not exactly sure what it's exactly called, but it's something that would keep my head stable in the machine.
Once the head frame is secured, then the patient will get an MRI with the head frame on. And that MRI gives us the most up-to-date imaging to plan the treatment on that very day. And then the head frame is worn until the treatment's completed. The radiation itself is painless. You don't see or feel the radiation. And you're not radioactive, you don't carry any radiation in your body.
Honestly, that experience, it wasn't pleasant, it wasn't what anyone wants to do, but given what it was, it wasn't that bad to actually go through it.
It's an in and out procedure. I was there early in the morning and I was out before lunchtime.
Test results showed the tumor in Kelly's brain came from a tumor in her lung. Kelly is now on targeted therapy to treat that cancer. And joining us again is Dr. Zakaria. Kelly has been on quite a journey. How is she doing today?
Yeah, last time I saw Kelly in the office, she was actually doing fantastic, really getting back kind of into her normal activities and really with no evidence of tumor in the brain.
And it's really amazing that Kelly is able to enjoy her life despite the fact that she does have cancer. How does this Gamma Knife make such a difference?
Yeah, I mean, I think it's really echoed kind of the way we've moved as a field, which is trying to do things less invasively, really with preserving people's quality of life. And Gamma Knife as a technique is one of those things that really allows that, with really no interruption of people's lives, no interruption of whatever other therapies they might need. And it's, again, really minimizing time in the hospital, minimizing recovery, pain, and just allowing people to get back to their activities, be with their families, and do what they like to do.
And it is really amazing. Where do you see this going?
Yeah, I mean, I think this is just the tip of the iceberg. We're constantly moving forward in terms of improving technologies and techniques to improve the treatment of patients with tumors in the brain. Gamma Knife is one of those amazing technologies. It's only going to get better. And along with other techniques, both in the operating room and out of the operating room, again, we're able to do things more effectively, more safely, and again, with that preservation of quality of life.
Okay, and as far as children, are they able to do Gamma Knife?
Yeah, so this is a procedure that's doesn't matter how young or old you are, and again, we've done it on a whole spectrum of people. So pediatric patients who are eligible are certainly able to be treated on this kind of machine.
Dr. Zakaria, a lot of really good information tonight. Thank you for being here. And we also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information or if you would like to schedule an appointment with Penn State Health, call 855-945-1282 or visit online at hmc.pennstatehealth.org/neurosurgery. And next Wednesday evening at 7:30, tune in to watch Penn State Health's Family Matters show. It's about keeping your family healthy during cold and flu season. You do not want to miss that. We want to thank you for watching tonight, and we wish you good health.